Welcome to the very first one of 12 video series with Dr. Sophia Capo with ABSee Optometry here in Kelowna. Thank you very much for joining us.
Thank you so much for having me.
Do you prefer to go by Dr. S?
Sophia is good.
Sophia?
Dr. Sophia, patients call me whatever makes them comfortable.
So you are a very unique offering to the community, Dr. Sophia. You have maybe the only or one of the only children-specific optometry clinics.
Yeah, I am super excited to tell you and to announce that we are the only children-specific optometry clinic in the interior. And we are supporting Kelowna and the surrounding cities everywhere in the Okanagan. We welcome all of our children and our special needs patients.
So do your patients, do they have to come to you from referral, or can a parent just bring their children to you? Or how?
So because I'm an optometrist, technically it's primary care, which means anyone can look us up, find us in the community, and self-refer. So come right in, book an appointment. But a lot of our patients tend to be referred in because a family doctor or some sort of other provider will find a problem and then send it to us. But it doesn't necessarily have to be the case.
So, Sophia, the practice, how long has the practice been open in Kelowna?
We have been open almost 1 year.
1 year?
Yeah.
Congratulations.
Thank you. We're very excited.
That's a big deal. So the clinic, have you been flooded with referrals from doctors? If there wasn't this practice and this clinic or this service offering in the community, I mean, the community's thrilled to have you, whether they know it yet or not.
We have received a ton of referrals from supporting providers in the community, and we're super grateful for everyone who's recognizing that we're here and understanding our service. But there is still room for, and I think there's a lot of people who need the service but who haven't quite found us yet. There are a ton of optometrists in the community who provide very, very great care. What I do is just a little bit different in the sense of the specific children's care that we provide.
Okay. So the services that you're offering specific to children, can we just talk a bit about eye care, very general about eye care for children? How you have a baby. Now what?
You have a baby, now what?
Yeah.
So it is very normal for a infant's eyes to look kind of wonky. So in the first about 6 months of life, babies look like they might be cross-eyed, or they're looking at one spot, but they're maybe not quite pointing their eyes at you. And that's perfectly normal because they're just still figuring out how to move their eyes. They're still figuring out how eyes work. But once babies turn about 6 months, that's when it's recommended for them to have their first eye exam. So at 6 months old is when their eyes should be straight. If they're not looking like they're aligned at that time, that's when there might be a problem that needs some sort of intervention. We're also looking at the 6-month appointment to rule out really bad eye conditions like health problems with the back of the eye, things like amblyopia, which is a lazy eye, eye turns, that's called strabismus, and really high glasses prescriptions. So anything that we can find when they're very, very young, our chances of being able to fully correct them and this outcome of success later on in life is a lot better if we can fix it when they're really young.
So early identification is
definitely
absolutely key. And I can tell you, Dr. Sophia, I have 3 children. I did, and I'm...
You never brought them for a 6-month appointment, did you?
That's
okay. A lot of people don't know.
Yeah, a lot of people don't know. So if there is a single message that we can get out today, it's tell two people, anybody that has children, 6 months or older, the question.
Yeah, and if you miss the 6 month, that is absolutely okay. but the earlier the better. So if you have a child who's 2 or who's 3 and you're like, oh, I haven't taken them yet.
Just come in.
Just come in.
And again, I'm assuming this is covered through
so
basic benefits?
In BC,
Okay.
MSP, our health coverage, covers a portion of optometry services. So usually there's a fee after that. But if anyone has extended health coverage, so through like their work benefits, then the appointments get run through that as well.
Okay. So we have, this is one of 12. You have great plans for the series in bringing in different guests and really around the goal of educating the community that A, you're here, B, there is enormous benefit to seeking eye exams and eye healthcare early. And then you do a tremendous amount of specialization, or I guess I shouldn't say that, but you practice in disabilities or
yeah. So let me tell you what we do differently for children specifically. So like a child comes into our office and they're welcomed by a super amount of fun things. So we don't like to call it eye exams. We call it fun eye games because eye exams can be incredibly intimidating. And it's a really common misconception that a child needs to be able to read or needs to know all of their letters or he needs to be able to participate in order for an optometrist to get a valuable piece of information. Because, for example, if you bring a 6-month-old in, I can still get a ton of really, really great data. I can actually get all the data I would get on an adult on a 6-month-old without them providing any feedback. But let's go back. So someone walks into the clinic, they're welcomed by an amount of kids' fun things. So we have a huge chalkboard wall, we have a Lego block station, we have a whole book station, and just a welcoming area for children to be. We have our treasure box, which is guarded by Larry, our 3D printed dragon. And the kids are welcome to hang out, stay there, chill, and feel welcomed while they're waiting for me to come get them. Then what an eye exam looks like is we're trying to figure out what they can see. So whether they can see a grading pattern on a paddle, or whether that's them following a light that's flashing and getting their attention, or matching letters or matching symbols to something far away. That's how we get their acuity. Then eye drops are always involved at an appointment. And eye drops are one step that is sometimes missed, but is the most important step in an eye exam.
Okay.
And so we put an eye drop in a child's eyes. They are 9 times out of 10 absolutely fine. It's more the anticipation rather than the actual feeling of the drop. It's like going swimming and getting water in your eyes.
Okay.
And then after that, we watch a movie. And while the kid's looking straight at the movie, whatever movie they want, because we can do that now with our technology, then I can check the health and I can check glasses prescription and everything else. Pretty simply.
That's amazing. Dr. Sophia, one more thing before you go. Can you share with us just an insight into your unique training that you have?
Yeah, so all optometrists have to go through a ton of school in order to be considered, a doctor who can practice. So I did my undergraduate degree, and then I did optometry school. But then I went on to do a unique year after optometry school called a residency. And that residency was focused in pediatrics and vision rehabilitation. And that year was essentially a full year focused just on treating children. So I obtained a ton of knowledge and skills with complex pediatric patients. So we worked a lot in hospital. We worked with a lot of the eye surgeons. I was able to treat a ton of the special needs population, the nonverbal population. So I have a lot of experience with not just, our general public children, but also the higher risk children, those children who need assessments and intervention more.
And I think that's so critical if you look at having the tools in the toolkit when you can identify and see something based on an experience. So a full year of residency is huge.
Year extra. Yeah. Yeah, and then even locally here in town, I work with the pediatric ophthalmologists. So those are the eye surgeons, helping them with their care because their wait lists are also overwhelmingly long. And I can take on a lot of that burden for the community to ensure that these kids are getting seen faster and that they're getting these early interventions that we know are incredibly important.
So critically important to have you in the community.
Thank you.
So, Dr. Sophia, thank you very much for coming in today and giving us just a very brief overview of the services that you offer. Stay tuned for 11 more shows, and you're going to help educate us in better eye care and how to care for children's eyesight.
Thank you so much for having me.
Thank you for coming in.